Mr. Bhaumik, you should be starting, no?
Okay, I'll start then, huh? Right. Good evening, everybody. Good evening, and I am extremely happy to note that we have got a very high recorded attendees here today. And I really thank the entire homeopathy fraternity for being with us, Dr. Wilmer Schwabe here today, for doing a very special webinar. And you all know it's about the second wave. While on this, I would like to say that the second wave and the year of pandemic, as reported and warned also by WHO, would be deadlier than the first. And the double mutation in key areas of the virus spike protein has made the virus more infectious and allowed it to escape the immune system. And we all know that the rise in the case numbers have been exponential in the second wave, and the rise, I believe, was not entirely unexpected, given that we let our guards down and a false sense of normalcy also had crept in. When daily infections in January fell to fewer than 20,000 and from a peak of over 90,000 in September 2020. But it's never too late to take measures, and we need to strengthen the safety protocols and rapidly vaccinate people and also keep an eye on mutations. If we do this, I think we could really reduce numbers significantly. And while on this, we have seen that the virus has evolved to have medicines, especially in allopathy, but unfortunately, no standard protocol could really be ascertained, leading to devastating consequences in many cases, and the damage in many cases was catastrophic. So herein, doctors, it has become high time that homeopathy, being an integral part of Ayush, raises its head and stop being foisted as a mere excrescence. And we should do something to ascertain the veracity of homeopathy, at least during the first symptoms, if without missing the bus in recognizing the red flags of the dangerous turn of antibodies attacking the blood vessels. So herein, Dr. Wilmer Schwabe is there to present a webinar, and we have a very, very eminent speaker, and it would be a highlighting session for all of us today. And with this, before we go to the very coveted part of the program with Dr. Biswajit Basu sir, I would like to introduce Dr. R. Valavan. He is our head of scientific and medical affairs department of Schwabe India. And just to give a brief about Dr. Valavan, he looks after Schwabe India new product developments and homeopathy regulatory affairs and medico marketing. His noticeable research activities are in the areas of homeopathy quality control, drug proving, clinical trials, etc. He has presented papers in over 25 national and international forums, and he has co-authored about 3 books and has written over 200 articles and papers. And he's also the editorial board member of 3 journals. Besides this, he is an active homeopathy practitioner for more than 20 years, handling different types of patients, right from the acute to the chronic illnesses. Dr. Valavan, kindly take over and do your proceedings, sir.
Thank you, Mr. Bhaumik, for good introductory remarks on this event. For the last 1.5 years, the whole world has been facing the challenge of COVID-19. And yes, of course, we homeopaths also face this problem. And there are pros and cons for each and every system. And as in the past, homeopathy has excelled its therapeutic efficacy even during this difficult COVID-19 situation. And as the homeopathic law says that each individual is different. So at one point of time, when we treat one particular patient, when we are very much confident that, okay, I can treat all the COVID patients, but in another patient, we feel there is a difficulty. Patients are not improving. patients are not showing the result as we expect in the previous cases. So there is something still we have to learn. So there we have, there are so many stalwarts in our country, homeopathic stalwarts. And today we have a very, very eminent physician, Dr. Biswajit Basu sir. And we have, I'm really for long, the moment it was decided, thank you, sir. It was decided that his lecture would be there. I have been, every day I have been waiting for hearing his lecture to learn how we can handle the difficult cases. So first of all, thank you, sir, for giving your consent to deliver lecture in this webinar. And with this, I welcome you to this webinar. And I also welcome all the participants who have taken their time to join us to listen Dr. Basu's lecture. So I welcome you all, and I welcome the organizing team of Mr. Abhijit Baumik, as well as our marketing team, Mr. Shashank, and other people from the complete team of sales and marketing in the East, as well as from the head office. I welcome you all. And last but not the least, we are having very good support as a co-host from Dr. Suman Haldar time and again. So I welcome you, sir, for this wonderful event. So with this, I request Dr. Basu, sir, so please start your session. And before that, one request to the attendees that already as I explained about myself, there are many enthusiastic learners who are there in the attendees. So they have started putting the questions to Basu, sir. I would request to please reserve your questions till the end. Our session is up to 5:30. So maybe we can have last 15-20 minutes, sir, for the question answer session. Right. Okay. So I request you all to please put your queries under the Q&A area, question answer area. And then at the end, definitely, depending upon the time, Basu sir will answer each and every question. Thank you, sir. Please, over to you.
I think before Dr. Biswajit Basu sir starts off, we are all waiting patiently for his lecture. I would just give a very brief introduction of Dr. Biswajit Basu sir, although he requires no introduction, I know. So, but still, I think I would just like to give a brief introduction. For your knowledge, you know, Dr. Biswajit Basu sir, BHMS MD, he has stood first in the order of merit in the Materia Medica from Calcutta University. And he happens to be the chairman of BA, that is Bengal Academy of Applied Homeopathy. And he is the faculty, Department of Materia Medica, both UG and PG at DND Homeopathy Medical College in Kolkata. And he's a life member of HOMAI, HMAI, as we all know. And he's nominated a faculty mentor and guide, Hahnemann College of Homeopathy, London. And as we all know, and you must be knowing that he's practicing homeopathy for the last 32 years in Kolkata. And he has been invited and presented, I would say, papers in national and international homeopathy seminars and congresses, including Liga. He's also contributed as a resource person in relation with publication of Materia Medica of Indian drugs by CCRH, Government of India. And not only that, Dr. Basu has authored 3 books, namely an illustration on family history, an expedition on carcinosin, and an exposition on thyroidinum. And his articles are also published in different national and international indexed journals. Needless to mention, Dr. Basu has conducted hundreds of CMEs and bar refresher courses on applied homeopathy, including his talks on chronic disease and revisit Materia Medica in order to develop the homeopathy professionals. And very interestingly, let me inform you that in relation to COVID-19, second wave especially, he, as we all know, we have come to know that he is the first person to introduce Bryonia 200 as prophylaxis, entitled as BAH Protocol 2021. Moreover, he has conducted CMEs on effective homeopathy medicines for COVID-19, which has been illustrated in live cases and evidences. So let us all be glued to our seats. And now we hand over the session to Dr. Biswajit Basu sir, the most coveted speaker, and we are all intently waiting for your lecture. And I would request, alongside Dr. R. Valavan, to kindly moderate the session and tackle the question answer sessions at the end. So Dr. Biswajit Basu sir, the stage is for you.
Namaskar. Good afternoon to everybody. At the outset, first of all, I pay my gratitude and thanks to Wilman Swabe and especially Dr. Abhijit Bhomik, Dr. Bhalban and his entire team for giving me the opportunity to share my experiences before the learned homeopathic fraternity all over India. Now, at the outset, I also pay my thanks to my loving students, Dr. Suman Haldar, for being a co-host and helping Abhijit Bhomik sir to organize these webinars. Let us start our main topics. Actually, they asked me to tell something about the homeopathic applied approach to COVID-19 second wave. To me, actually, COVID-19 is not a mere pandemic, not mere disease. COVID-19 is a phenomena. There will be, in every phenomena, there will be cause and effect of the cause. In COVID-19, the cause is SARS-CoV-2 virus in different mutation, and effect of the cause is symptoms. We all know Hahnemann clearly defined and said in his Organon of Medicine, to treat any patient takes notes of nothing in every individual disease except the changes in the health of the body and of the mind. He categorically noted these as morbid phenomena. So as a homeopathic physician, we are to take notes of changes in the health of the body and the mind. According to conventional medicine, we all know till date there is no established cure for COVID-19. Scientists identified new virus, novel coronavirus for COVID-19, and therapeutic intervention is not curative. Medical schools are scared, all peoples are scared about the new disease and also the new mutated strain in the name of second wave. It has been observed that though COVID-19 is a pandemic disease, affected more higher and middle higher classes of people. So life situation and lifestyle plays a major role for development of the disease in its full extent. Depending upon the innate immunity and the sensitivity to react with the stimuli, that is cytokine storm, are the important deciding factors for mortality and morbidity in terms of hospitalization. As a homeopathic physician, we are very much concerned about the changes in the health of the body and of the mind, that is phenomena, in terms of presenting symptoms during illness, which grossly depends upon the miasmatic background and the constitution and the individual patient. So we should frame the true acute totality and we'll select a remedy which has the power to develop those symptoms in apparently healthy human being, what we are getting from our Mathematica. So any virus, whether it is old or new, whether several mutations took place or not, that matters little for selection of remedy in homeopathy. Whatever changes takes place on the end of cause, as cause differs, the effect of the cause will differ. And considering the array of symptoms, we will decide our medicine. So in every spell of mutation, we have to note nothing but the changes and consider as a new phenomena that will determine the choice of the remedy. In Hahnemann's lesser writing, Hahnemann beautifully asserted the dangerous mistake what homeopathic physician can do. He said, quote, did not distinguish the disease, did not examine what peculiar symptom are proper to this prevailing pandemic or epidemic. So he advised, two sole duties to perform for any homeopathic physician is, first, discriminating observation, second, discovery of the appropriate remedy. So for all practical purposes, homeopathy is in better position as a therapeutic tool to prevent and mitigate new disease and new strain as well. After thorough review of the relevant recent literature, it is found that the second wave has a new dimension with regard clinical presentation, rather clinical manifestation and progress, at the same time, infectivity, mortality, and morbidity. So you should keep in mind all those things as it relates to phenomena. But in order to prevent and mitigate the disease, every homeopathic physician should discriminately observe the symptoms to select the correct remedy. Another important observation, what I experienced while treating patient of second wave, like to share with the homeopathic fraternity. During first wave, most of the fresh cases was treated successfully with 1 or 2 or 3 medicine one after another. In first wave, indicated medicine acted very promptly and mitigated within 5 to 7 days. But in the second wave, what we are observing, the fresh cases are being treated with suitable remedy and dose. But after 24 or 36 hours, a new array of symptoms develops and points to another remedy. Despite of correct selection and mitigation of the disease, new symptom develops and it may continue up to 10 to 13 days with different effective medicine, one after another. Now I do like to share my screen with you people. That could be better. First of all, we should remember the warning from Central Council of Homeopathy. They told very clearly, Central Council of Homeopathy to take disciplinary action against homeopathy practitioners involved in false claims of treating COVID-19 patients on social media. So today's webinar, we are not claiming anything false. That is, it is being overruled. Another warning regarding Supreme Court, they told very clearly that no claim for cure can be made in homeopathy. There is no such claim in other therapy, including allopathy. The homeopathy is contemplated to be used in preventing and mitigating COVID-19, as is reflected by the advisory guideline issued by CCAs. Considering all those warning and verdict of the CCA, Supreme Court, Honorable Supreme Court, we will go forwards. Now I am presenting a case in first wave to make the difference in between. And first of all, we are presenting the consent from the patient. He has been given the kind consent to present his case. Starting the video, just get it.
Greetings. My name is Rupam Das. I am 29 years old. I am an employee of WBACTCL. On 2nd November, after having my lunch, I felt severe headache, and later on evening, my body temperature was started increasing, and it increased up to 103 degrees Fahrenheit. Then I have consulted with Dr. Biswajit Basu, and he advised me to intake few doses of Bryonia 200. And next day, I feel better, but my body temperature was 100 degrees Fahrenheit for throughout the day. On 6th November, I have completely lost my smelling senses, and then I tested and found COVID positive. As per doctor's advice, I had intake different doses of homeopathic medicines with healthy food and plenty amount of water. On 28th November, I retested and found COVID negative. But that time I felt very weak, and as per Dr. Basu's advice, I have to take good food with plenty amount of water, and at least for 4 or 5 weeks extra precaution. Now already 5 weeks crossed, I am absolutely fine, and a special thanks to Dr. Biswajit Basu.
Now I am inserting
Greetings.
the report.
My name is Rupam Das. I am 29 years old.
The positive report from Government of West Bengal Health and Family Welfare Department, with CT value was 21. In first wave, the CT value was 21 and patient was recovered very simple, a few doses of Bryonia, and treatment was concluded with sulfa 30. Different pills, what he actually told, that actually placebo, nothing else. And another report, that is COVID negative, on it was after 13 or 20 days, 15 days. Okay. Now I am presenting another case from second wave to get the difference and the phenomenological aspect. Once again, Mrs. Suparna Banerjee Ganguly given her consent, kind consent to present her case. I am presenting in detail. It is the report from the laboratory. Is CT value was N gene was 19, or one gene, one AB gene was 20. That is, viral load was very high. On first consultation, the symptom was scraping and burning sensation in throat, pain all over the body, annoying cough and chilliness, burning in eyes, unquenchable thirst, taking water, but throat remains dry all along. Yawning and stretching, illness. And at the same time, I am also presenting the typical tongue. I am not going to say something about the peculiarity of the tongue. You homeopathic doctors all know the red triangular tip of tongue, how typically it being present on the first day of COVID-19. And getting all those symptoms, we have prescribed Rastox 30. In the left side, we are presenting the table. Whenever I am treating any COVID patient, first of all, I am taking the consent from the patient, voluntary consent. They like to treat under homeopathic consideration. And I advise all of them to take note of oxygen saturation, pulse, and temperature in different times and different day. And whenever I prescribe Rastox 34 doses BD for 2 days, getting those medicine, the thing is we got oxygen saturation within 96 to 98, pulse was 123 to 107, and temperature was 100 to 101. On 3rd May, considering another area of symptom, what actually I told earlier, after getting medicine, few symptoms improves and another area of symptoms comes on in second wave. Considering all those symptoms, I prescribed Bryonia 204 dose. On 3rd May, on 4th onwards, she took the medicine. The saturation was like that within 96 to 98. Pulse was within 102 to 118. Temperature was within 98 to 100. After that, on 7th May, once again, develops few symptoms of Rastox. And considering that, once again, I have prescribed Rastox 30. And in those days, saturation was 96, somewhere rather low than before. Pulse was 93 to 109, and temperature was 97 to 101. And on 8th, there was no medicine on the placebo. The temperature dropped down to up to 97 and 98, but the saturation was within 95 all along the day. On 9th May, once again, she consulted me, and getting consultation, we get few symptoms favoring arsenic album. One was, I could remember, nausea and vomiting. Another was, she was very much panic about her ailments, whether I will be hospitalized, is there anything happen bad will take me with me, like all those things she was asking me. And considering all those, depending upon the presenting totality, I prescribe arsenic album 34 doses BD. On 10th May, saturation was 94, 95, 95, but temperature was within normal range. Getting arsenic, what happened actually, the temperature was normal, but the saturation not being normal. After that, considering all those symptoms and the remaining phenomena, I consider sulfa 32 dose OD on 12th May, and she took the medicine from 13th May early morning onwards. You see the beautiful result after getting the antisoric medicine and passing out all the medicines phenomena. The saturation is being improved. And ultimately, 14th onwards, we are getting the beautiful saturation, 98, 99, like all those things, pulse is normal. Why I am presenting this case before you people? Whenever we are treating in the second wave, despite of selection of correct remedy and administration of correct remedy, the symptom is not abated totally. One after another different medicine is being required. That is why I presented this case. And one thing I am also like to note, whenever we are prescribing short-acting acute medicines, temperature is normal, but the saturation is not up to the mark. In those cases, considering the miasmatic background and all those things, whenever we are prescribing the defective medicine, how beautifully 94 saturation is being normal within 1 or 2 days without any oxygen support. There is a positive report of the patient on 4th May. It is a negative report of the patient on 21st May. One thing is very important. Here also the CT value is very low. Whenever we are getting any COVID patient with low CT value, there is chance of complication is more. In modern medicine, regarding the prognostic value, whenever they are taking any patient with low CT value, they are very cautious. Not necessarily every patient with low CT value will suffer a lot, but the most of the patient, those who are needs for hospitalization and all the supporting treatment, most of them having low CT value, that is viral load is high. Now I am stopping sharing my slide. Later on, I will show if needs. So our today's objective for discussion. Actually, now we are entering to our main topics. The phenomenological perspective of COVID-19 from preventive aspect and treatment aspect. And treatment aspect should be for fresh case, for complicated cases treated by allopathy or homeopathy, or complicated cases during recovery stage at home or post-COVID syndrome. Most common symptom of COVID-19, whatever we are getting in second wave also, fever with severe body ache, dry cough, tiredness, and GI symptoms. A less common symptom, throat, conjunctivitis, headache. Another important symptom is loss of taste and smell. Another less common symptom, a rash on skin or discoloration. Serious symptom is difficulty breathing or shortness of breath, chest pain or pressure, or loss of speech or movement. So first of all, for second wave, we are going for preventive part. To select a specific preventive medicine in order to prevent and mitigate, eventually minimize hospitalization, preventive medicine, any one preventive medicine is to be required to prevent the pandemic or epidemic. Another important point, along with preventive medicine, constitutional treatment may be continued. Apart from that, we have found patients, those who are taking constitutional medicine for chronic disease, hardly they have suffered from COVID-19. Along with all measures, preventive medicine, constitutional medicine, anti-miasmatic medicine, we should go for open air exercise, we should take nutritious diet, along with we should maintain or practice COVID behavior, that is wearing mask, maintaining social distancing and sanitization for all along. It may be easily happen that in the first case of an epidemic disease that presents itself to the physician notice, it does not at once obtain a knowledge of its complete picture. What happened in first wave? Whenever we are selecting arsenic as a preventive medicine, in that point, we are not having much of knowledge about COVID-19 manifestation. It is only by a close observation of several cases of every such collective disease that he can become conversant with the totality of its signs and symptoms. So in the course of writing down the symptom of several cases, the disease picture comes ever more and more complete. On the other hand, more significant, more characteristics, including more of the peculiarities of the collective disease. Not peculiarities of the individual, peculiarities of the collective disease. On the other hand, the general symptoms, loss of appetite, sleeplessness, become precisely defined as to their peculiarities. The more marked and special symptoms, which are peculiar to few disease and of rare occurrence, at least in the same combination, become prominent and constitute what is characteristics of this epidemic, which is essential for enabling us to choose the most suitable homeopathic remedy for the array of symptoms is obtained by complete survey of the morbid picture. Cannot be learned from one single patient, but it is only to be perfectly deduced, rather abstracted and asserted from the suffering of several patients of different constitution. In perceiving what is to be cured in disease, one must proceed from generals to particulars. Study disease in its most general features, not as seen upon the particular individual, but upon the whole human race. We will endeavor to bring this idea before the mind by taking as an example one of the acute miasm, not for the purpose of diagnosis, but to arrange it for a therapeutic examination. If the epidemic is entirely different from anything that happened earlier, it is at first confusing. Rather, we are being confused for 1.5 years with a new disease. From the first few cases, the physician has a very vague idea of his disease, for he sees only a fragment of it and gets only a portion of its symptoms. One of the stalwarts in homeopathic field, J.T. Kent, said very clearly, in epidemic spreads, many patients are visited. At least 20 individuals have perhaps been closely observed. Unless or until we observe at least 20 patients, we are not deduced or supposed to declare any medicine as a preventive one for that particular epidemic. 20 patients may suffer from headache, body ache, pain in the muscle, and at once it would be considered as a part of the epidemic. All the patients may have some common symptoms, like fever as pathognomic symptom. And so, by taking the entire scheme and studying it as a whole, as if one patient had experienced all the symptoms. We have collected all the symptoms from different persons, but we are considering whenever we are making the totality for selection of one medicine as a preventive medicine, as if one patient had experienced all the symptoms. Regarding weightage of symptoms, what part we should give more emphasis? Once again, I do like to happy to quote from Hahnemann's lesser writing in Cure and Prevention of Scarlet Fever chapter. He said, I reason thus, a remedy that is capable of quickly checking a disease in its onset must be the best preventive. Considering this idea and the principle of homeopathic philosophy, we have studied all the symptoms from different patients and how we have deduced Bryonia. Now let us see. Once again, I am sharing my screen for repertorial chart. Here is a repertorial chart before you. We have noted almost all the symptoms from collected from different patients, different literature, source literatures and recent literature, relevant literature. And whenever we have put it all together, according to Marx, the first medicine came Persicula, then Nux vomica, and Bryonia is lagging behind. But what Hahnemann said in his lesser writing, we should give more emphasis to the symptom as onset of the disease. Whenever we have put all the symptoms and onset of the disease and repertorization done, we got Bryonia out of 10 symptoms, scores 32. Out of 10 symptoms, arsenic is 30. Out of 10 symptoms, Nux vomica is 27. Out of 9 symptoms, Rastox is 22. Out of 8, Persicula is 22. And what I observed actually in different cases, What are the common medicine is requiring for COVID-19 second wave are almost all those medicines. Now I am also presenting another repertorial sheet from few another symptoms. Pain in lower limbs. Just putting together all those symptoms, the first medicine ranking height was Rastov, then Bryonia, then Pyrogen, and all those things. Then headache during fever is a common symptom to almost all of the patients during first or the onset of the disease. Whenever we have repertorized those symptoms, the first medicine came also, once again Bryonia. Coryza with loss of smell, whenever we put it in repertory, concomitant smell loss of, in bone incursion in NAR, we got important two medicine, that is Pulsatilla and Nux vomica. Here is the Bryonia is not in first gate, but whenever we are search out whether Bryonia is present or not, we got it. In NAR repertory, Coryza smell loss of, Bryonia the third grade remedy. Still Bryonia is acting on loss of smell. Then complicated fever, whenever I put it all those symptoms in the later stage, once again the first medicine came Bryonia, arsenic, then the second is Bryonia. Considering all, we have made a protocol. The protocol itself self-demonstrating about the medicine and the dose. Once again, I am telling before you. For adult, it is Bryonia 202 globules with 4 TS of water in empty stomach. And for children up to 12, we are sitting 1 globule. First day, first dose. Second day, second dose, 24 hours after first dose. Fourth day, third dose, 48 hours after second dose. Seventh day, fourth dose, 72 hours after third dose. You may have questions. Why you are giving or advising this type of taking of medicine in different date with different gaps? Whenever Hahnemann was working on scarlet fever during the then time, he clearly noted in lesser writing, when the prevalence was low, he advocated medicine at 72 hours interval. But the prevalence was high, when he advocated in 72 hours interval, it did not act well. And he decided, whatever I have placed here, the dose regulation on first day, second day, fourth day, and seventh day, it is nothing from me. It was observation of Hahnemann. He observed during scarlet fever, and considering the prevalence and severity of the disease now, what is happening in our country, I advocated this type of dose determination for Bryonia. So it is a preventive dose for new strain started. We have started this protocol on 27th April 2021, while there was no protocol in our country. So far my knowledge is concerned, Central Council for Research in Homeopathy, they have published a protocol, or that protocol advisory at the first week of May. Now I am placing the graphical presentation from different parts of our country. People, doctors are participating in our program, and they have administered medicine from Jharkhand to Gujarat to Maharashtra, from different parts of state and our country. Sex response, a female about 37.8 and male about 52. A residency survey, different parts of our state. Consent response 100%. All are voluntarily participated in the program. Vaccination status, it is very important. People, those who have already vaccinated, they are also interested to take Bryonia 200 protocol. About 20.3%, those who have participated in our VA protocol, they have also vaccinated, but still they are interested to take VA protocol medicine, Bryonia 200. After getting medicine for last 1 month, what we have observed, among all, whatever the number, only 2% patients have suffered from COVID-19. Among all, whoever took Bryonia 200 in defined protocol, in defined doses, only 2% participants have been suffered from COVID-19. Exposure response like that, patient, those who have taken Bryonia protocol, no active COVID case. And taking Bryonia, we have different questions in our Google form. whether you have suffered from or got any ailments during taking medicine. A few, at least 2 to 3% participants reported malaise developed after third dose and COVID test positive on 9th May. Once one written slight headache, pain in lower extremity, one heaviness in upper abdomen, headache, cough, hard stool, like that. Almost out of 100, 2 to 3% participants got few symptoms, but nothing positive. The COVID positive during BA protocol first phase, only 2%. So those who are chronic patient and under antibiotic treatment, chances of attack is very less, what I observed. In spite of the regular treatment, prophylactic treatment may be adopted. Those who are not under treatment, they may be supported with constitutional treatment to boost up and sustain the action of genus epidemicus. I am happy to share you a page of a research paper from ResearchGate. Recently, it has been published just 3 to 4 days ago. They have demonstrated in vitro and vivo the anti-inflammatory property, that is the inhibitory property of cytokine storm of arnica, thuja, and bryonia. So it is being now demonstrated in laboratory. Bryonia is possible to control or inhibit cytokine storm. The abstract of that paper was the lipopolysaccharide induced cytokine release and oxidative stress are validated experimental parameter used to test anti-inflammatory activity. They said, we investigated the effects of homeopathic mother tincture, 6, 30, and 200 dilution of arnica, thuja, and bryonia against LPS induced cytokine release from and cells and human whole blood culture. In our observation, what we got, person who took bryonia 200 as preventive medicine and defined dose, that is 1, 2, 4, and 7. Among them, 2 to 3% got COVID infection. But despite of their low C2 value, 19 to 21 of RT-PCR, that is high viral load, they manifested very minimum symptom. Low grade fever for 6 hours only. Another patient anosmia for 3 to 4 days and recovered without any complication. One of the participants, those who suffered from COVID-19, is about 70 and he has a known strong comorbidity, having suffering from cardiac trouble, hyperlipidemia, hypertension, and blood sugar. Despite of all, as he took bryonia 200 in defined dose, he developed only temperature for 5 to 6 hours, nothing more. About 2% felt slight feverish sensation for few hours after taking bryonia, heaviness in head and all those things. And in all the minor ailments has been abated spontaneously without any medicine after taking third or fourth dose. From these consequences, hypothetically, we may say bryonia 200 may combat cytokine storms. It is the time we should go for research in laboratory with all equipments, how bryonia 200, whether it is possible to combat cytokine storms or not. Person who took bryonia 200 as preventive medicine in defined dose, among them only 2 to 3% got COVID positive and with low symptoms. Now once again I am stop sharing. Now I am going forward for the preventive part. Already you have told and detailed about the bryonia protocol and the preventive part of COVID-19 second wave. Now I am going forward for the treatment part. Before selection of remedy for a given case, we must ascertain the particular symptom of which the patient complains through discriminating observation, what Hahnemann said. Prodrome stage, symptom occurring before and during chill, heat and sweat, and stage of apyrexia. All those things used to be taken under consideration. If possible, to know the constitution of the patient, as well as the constitutional elements aroused by the fever are all to be carefully noted. The physician who has already in the first cases been able to choose a remedy approximating to the homeopathic specific will, from the subsequent cases, be enabled either to verify the suitableness of the medicine chosen or to discover a more appropriate, the most appropriate homeopathic remedy. Every new patient may have new symptom. He has put his own stamp on the disease. Those symptoms that run through all other pathognomonic symptoms, those which are rare, are the peculiarities of the different people, which is to find in general in the remedies that correspond to the epidemic. So for all practical purpose, after eliminating all the symptoms, we'll get about 7 to 10 remedies run through the picture, and therefore are related to the epidemic corresponding to its whole nature. This may be called a group of epidemic remedies for the particular epidemic, and with this, we'll manage to cure all the cases. The question arises, which one is a remedy for each individual case? When we are working out of 10 to 12 remedies, should go through the Mathematica, get their individual pictures to use them successfully. Thus, we have to proceed from generals to particulars, and there is no other way to proceed in homeopathy. Every patient has also a certain state of peculiarities that identifies him as an individual patient. Likewise, every remedy has in itself a certain state of peculiarities that identifies it as an individual remedy. And so the remedy is fitted to the particular patient. While one of the remedies in the epidemic group will most likely be indicated in many cases, yet if none of these should be fit the patient, the physician must return to his original anamnesis to see which one of the other remedies is suitable. In every case, treatment should be concluded the suitable antisoric drug. Now I am telling about another important thing, what I have told earlier, just at the introductory part of my session. Lifestyle and disease prevalence of COVID, what we have observed in different countries also, mostly higher economic classes of people and middle higher class, they are suffering a lot. So there may be some relationship of cytokine storm with life situation. In COVID patient, excessive cytokine storm, the immune system is producing too many inflammatory signals, develop life-threatening symptoms for COVID-19. It is a cascade of exaggerated immune response that can cause serious problems. Very low blood pressure, increased blood clotting can also be hallmark of severe cytokine storm syndrome. Along with, we are also observing elevated levels of interleukin-6. Both the subchronic inflammatory response and cytokine storm might crucially be involved in the immediate manifestation of neuropsychiatric symptom in individuals with COVID-19 infection, as well as heightened expression of psychiatric symptom in COVID-19 patient. Grief, anxiety, intense stress is one of the important factors which sensitize the immunological status of the individual. With the help of homeopathic medicine, if we can modify the underlying stress, the severity will be minimized easily. Now I am telling few medicines commonly used in second wave with its life situation and disposition. You all know about the particular symptoms of those medicine from different Mathematica. But what I observed with those patients regarding the life situation and disposition that may act as an instinct for cytokine storm, I am sharing with you. For arsenic album, most of the arsenic album patient, if we consider the life situation, extraordinary health conscious, feels mentally and physically weak and feeling I am defenseless. He likes people and also depends on them, and being alone suffer from panic attack during COVID period. Not at all like to go outside, not like to take outside foods. Cautiousness, carefulness tends to compulsive obsession, leads to fastidiousness. Arsenic patient, they are also think over money matter. Their consideration is only two. One is health, another is money. So whenever we are treating any patient and we are giving arsenic, the patient who have this type of life situation or disposition in their constitution, they will be more vulnerable for development of arsenic-like syndrome. I am not going detail regarding the arsenic particulars, what we are getting in common mathematical. If we consult repertory, putting all those life situation and disposition, we will get fear alone of being, lest he die. The medicine is arsenic, phosphorus, and kalicum. Company desire for alone while aggravation. The fast grade medicine is arsenic and phosphorus. Careful and conscientious. Fast grade medicine is arsenic and falsitilla. Second is naxomic and sulfur. Talks of business. First grade is bryonia, and third grade is arsenic. Just if we analyze the repertorial chart, we will get the idea. Whenever we are prescribing arsenic for any patient and being mitigated to some extent, when symptom remains or new symptoms develop, considering the life situation, what medicine will generally come? Either phosphorus or naxomica or pulsatilla or bryonia or sulfur or kalicum. So, likewise, we may think about bryonia. In bryonia, what is the life situation and disposition we are getting? Once again, I am not telling about the particular symptoms of those medicine. You will all get in different types of mathematical. In bryonia, the main obsession of bryonia is the feeling of loss in business. Whatever we see in the society in respect to COVID-19 affection, there are especially three groups of people, either very rich or very poor. They are not bothered about money and all those things. The middle class people or higher middle class people, they are very much concerned about money. And money comes out of business or out of service, nothing more. So the patient, those who are very much concerned about business, not service, not any other thing. People, those who are under stress due to business embarrassment. The situation takes place for lockdown and all those things, the situation of business. What actually happening? The person who are being stressed out of those things, for that person especially, bryonia would be a very good remedy. In bryonia, you are getting main obsession of bryonia is a feeling of loss in business. Loss of business or fear of poverty is a core symptom of bryonia. If we go through repertory, in delirium, in delusion, we will get the symptoms, fear of being poverty. One thing is very important from bryonia patient. Whenever you are attending any patient for COVID-19, you just ask his occupation, and he may say that I am the businessman. Well, how long, as you were suffering from headache and all those things, how long you being absent from your business? No, sir. Today morning, just today morning, I have attended my shop. Just returning from shop, I am making call with you. This is a beautiful symptom of bryonia. Until we become seriously ill, we will attend the business. Naxomica also having this type of attitude, but this is not for business or money. Naxomica wants to complete the work, having the passion for work. If we consult repertory regarding life situation of bryonia and disposition rubrics, talks about business, bryonia first grade, arsenic third grade, phosphorus third grade, fear of poverty, bryonia first grade, sorinum second grade, sulfur second grade, dream of business, bryonia and pulsatilla, delusion of fancy business, bryonia and phosphorus. So whenever we prescribe bryonia, along with considering the life situation and the particular symptoms of presenting totality, and getting bryonia, somehow or other it has been improved in second wave, but not recovered properly. In those cases, pulsatilla may be a very good remedy following bryonia. Phosphorus may be a very good remedy following bryonia. Even sorinum may be required to complete the action of bryonia. Now I am telling about another important medicine, what I have been using in the second wave for last 2 months. Another is very good medicine is Rastox. Rastox have been under constant anxiety, as if something bad will happen, anticipated. Whenever we are inquiring any Rastox patient and prescribing any medicine, after getting all those things, invariably they ask us, sir, whether I will be recovered. Is there any need for any examination? Whether I will go for HSCT scan, whether I will go for D-dimer. Why he is telling, why she is telling all those things? Getting information from different social media, all people are know now what is the investigation parameters in COVID-19. As they are under constant anxiety, something bad will happen. And Rastox patient is feeling of helplessness, being forsaken in the house, but hardly seeking help from outsiders. Very apprehensive about his illness. And Bryonia in Rastox patient, what restlessness we are getting, amelioration from motion. It is not mere physical restlessness and amelioration by motion. Patient is very much restless internally. That is why moving about in this room and getting relief, discharging all tension and anxieties. Then if we put the rubrics, anxiety, arsenic, bryonia, Rastox, all are in first grade. Fear of evil, Rastox, second grade. Calcarea carb, second grade. Soridum, first grade. Fears, dread, death, fatal disease. Arsenic, Naxvomika, phosphorus, Sorinum, Rastox, all are having fear, dread, death, fatal disease. So in this case also, whenever Rastox is being administered, acted somehow or other to some extent, but not completed the case in second wave, the medicine should be in relationship, arsenic, bryonia, calcarea carb, Naxvomika, phosphorus, Sorinum, like that. One thing I would like to share with you from J.T. Kent's Mathematica about Rastox. You all know, people are telling, all the doctors are telling, in second wave, the main dangerous thing is, it starts the disease COVID-19 within 24 or 48 hours, patient become very serious and requires oxygen support and all those things. And for that reason, the people are very much scared about bed, about oxygen and all those things. That is the main thing we are getting in COVID-19 second wave. How beautifully it has been narrated in Kent's Mathematica. Just I am reading out. Begin in the nose and extend into larynx with hoarseness with RAS symptoms. Then RAS respiration is hurried. Operation of the chest. Very difficult and hard breathing, especially pneumonia and bronchitis in cold that settle in the chest. RAS gets out of breath on exertion, that is low oxygen saturation. The cough of RAS is very tormenting. Teasing cough, that is typical COVID cough what we are getting. Paroxysm of the almost any kind, tormenting cough before and during chill. He knows that the chill is coming because of the dry teasing cough. Cough with taste of blood in the mouth. So, if at the initial phase of the disease, at the onset of disease, any patient is presenting with typical life situation and particular symptom of Rastox, and if we do correctly prescribe Rastox at the onset of the disease, it will avoid all the possibilities for complication of the disease, oxygen therapy, and hospitalization. In this way, prescribing correct medicine in correct situation, we will minimize hospitalization. Now I am sharing another medicine, Pulsatilla, life situation and disposition, soft and gentle to get more affection and attention. We know Pulsatilla is very soft and gentle, but we should know what is the underlying instinct behind it. Soft and gentle, why? To get more affection and attention. Underlying which? Jealousy is the instinct. Pulsatilla is a very good medicine for sibling jealousy. In nuclear family, now almost in most of the family we are having one child. In those cases, the particular child either having some fascination with father or mother, when Father approach to mother in any situation and like to talk with her mother or his mother. Particular child does not like it, and he or she became furious. Very dependent at the same time, not allowing anyone to be dependent from the getting affection and support. He or she is dependable to anyone. At the same time, not allowing to be dependent to other person. Whenever not getting desired things, feels forsaken. In other words, though they are mild and gentle, Pulsatilla is very selfish about affection and attention. Not miser selfish like Lycopodium. So whenever we are asking or taking cases in COVID patient, we just ask, along with particular symptoms, particular all those things, we just ask one thing. What his or her attitude to his family members? Invariably, the parents will say, she is very much conscious about her affection and her attention. Otherwise, she is very gentle. But whenever anything happens, we did not give more attention to her, she becomes furious or at last start to weep. Considering all those situation, life situation, Pulsatilla patient is under stress. And due to that stress, whenever COVID infection gets in, due to that stress, the typical cytokine storm will take place corresponding to the Pulsatilla manifestation. And if we put all those symptoms in our repertory, forsaken at evening, Pulsatilla. I have seen several cases of Pulsatilla in COVID-19 in general fever. Generally, especially during evening, when fever commences, fever paroxysm comes, Pulsatilla patient hardly allows anybody to go outside from the house. Everybody should attend him. That is forsaken at evening. Selfishness, the medicine Pulsatilla and Salpeterol. Yielding disposition, Pulsatilla first grade. Elements from jealousy, Pulsatilla second grade. Another important point, especially for child, they like to be carried slowly. Another one medicine is very important, desired to be carried first, that is arsenic. I am not going in detail for the particulars of Pulsatilla regarding anosmia during coryza and all those very beautiful symptoms you will get from any Materia Medica books. But I am suggesting whenever you are selecting medicine for COVID-19 as fever, all those things, you must consult intermittent fever of HCLN along with Borix Materia Medica, and side by side for reference, you must carry Herring's guiding symptom. Now I am telling about another medicine, Nag's vomica, life situation and disposition. In recent past, during second wave, I have seen, unfortunately, as group within 35 to 45 years, many young chaps have died out of COVID-19. Those who are working in IT sector or in private sector or in private bank on all those places. And considering those lives, I deduced what is the actual fact is happening. The people, those who are working for a long time in any private sector or IT sector, generally they are ardent. So ardent is the main thing. Ardent character is the hallmark of Nag's vomica. Whenever we are treating any patient developing few symptoms, common symptoms of COVID, if we ask about the occupation of the patient, then we will get the thing whether he is ardent or not. They're very industrious, ambitious, and main thing is passionate. Last night at about 2 a.m., he just lastly completed his work and submitted, though the fever was 102, though he was suffering very badly. That is the tendency of Nag's vomica patient. Assigned job is to be completed by hook and crook. They're irritable, impatient, passionate, and fastidious. Fastidious, not like arsenic, out of fear of disease. Fastidious about his work environment. Actually, underlying which perfectionist attitude is going on. As Naxvomika patient is putting strain on evacuation, likewise, we are strained to complete the work. At the same time, we are getting rubrics in repertory, fear of poverty, Naxvomika. People, those who are working in IT sector and private sector, they are also having anticipatory idea, I may lose my job. So ardent character with an appreciation to lose my job and all those things in the life situation that leads to stress and sensitiveness. And whenever they are getting COVID infection, out of this sensitiveness, a typical cytokine storm will take place that may lead to death. But if we prescribe Naxvomika on the first day, everything will be abated and mitigated. So if we put all the rubrics in repertory, ardent, you will be astonished to know there is no other remedy in homeopathy except Naxvomika in first grade. Single medicine in cancer repertory. Impatient Naxvomika, first grade. Fear of poverty, Naxvomika, third grade. Bryonia, first grade. Sorinum, second grade. Elements from business failure or service, anything, Naxvomika is third grade. So whenever we are prescribing Naxvomika in COVID second wave, somehow or other it has been improved or mitigated beautifully, but not recovered correctly. Either sorinum or sulfur may require to complete the case. Now I am telling few anti-miasmatic depicting medicine is being required during second stage. The first is sulfur. Sulfur patient's life situation disposition, stress come from humiliation, wounded pride. And sulfur patient always having a constant effort to overcome it, to be someone. His struggle is oriented mainly towards ego and honor, generally optimistic. So they are under stress always. We all know sulfur is very anxious. At the same time, having constant effort to overcome, to be someone. Inquisitiveness is another nature of sulfur, always theorizing. And another one important thing is wants to be appreciated. Whenever anyone is not appreciated in his office, whenever anyone is not appreciated in his house and being humiliated, he or she is under stress. And that is the life situation. On this base, when COVID infection took place, typical cytokine storm will take place and develop symptoms like sulfur. In those cases, sulfur will be the remedy. And if we put all those rubrics in repertory, impatient, Naxvomika and sulfur, fear of poverty, sulfur, foolish behavior, happiness, pride, that is very important thing. Actually, he is not so much intelligent, but mimicking those things. In this respect, the repertory is being coined in Kent's repertory, foolish behavior, happiness, pride, sulfur, but it is single medicine. So, if we know the life situation along with particular symptom, what is written in Mathematica, we safely treat and mitigate COVID patients in time. Another important medicine is Maxol. A very beautiful medicine, generally recover at the end part of the disease, when disease is being complicated. But if symptom correspond, and if we know the life situation of the patient, and if we get the chance to prescribe Maxol within 2 to 3 days, chance of complication will be less and less. The main obsession of Maxol is nobody will favor me. As if surrounded by enemy, everyone is my enemy. Suppression of emotion from extremely dictatorial authority. We all know, due to COVID situation, people are compelled to go to their office, those who are attending their emergency service. It is mandatory for them, but all people are not going willingly. Those who are not going willingly, they are telling different type of excuse not to attend their office or not to attend their duties. But whenever the authority give pressure, whenever the authority behave with dictatorial attitude, then the marks of patient is being under stress. So people, those who are working under dictatorial authority during COVID situation and compelled to go with strong unwillingness, they are having some stress. There is very bad stress and sensitivity. In that sensitivity, when COVID infection takes place, typical cytokine storm will take place. That invites Marksall pathogenesis. That is, hemorrhage in the lungs and all those things will happen and takes place. So, if we consider and know the life situation and disposition of the Marksall patient, along with night aggravation, perspiration, thirst, moist tongue, all those things, whatever written in our Metria Medica, we should safely prescribe Marksall and will abate the apprehended complication and hospitalization, oxygen therapy, all those things. We go through repertory, delusion enemy about mercury, delusion surrounded enemy mercury, dictatorial mercury, lycopodium. We are getting all those rubrics in Metria Medica. Now I am telling about life situation and disposition of Thuja, another beautiful medicine I have prescribed for a few cases, but it acted so nicely and recovered so nicely, especially those who are treated under different system of medicine. And they declared you are having some fibrosis in your lung, your fever will continue for 1.5 months like this, your CRP will not be down within 3 months, and most of the part of whatever has been damaged in your lung, it will be compromised and fibrosed. In those cases, whenever the life situation permits, whenever the particular symptom permits, whenever the myometric background permits, and I could select Thuja, it acted beautifully. What is the life situation and disposition of Thuja? He presents an elevated picture of himself. First of all, what is saying Thuja patient? His oxygen saturation is 84. Whenever the relatives, the doctors, anyone is asking, what is your trouble? No trouble, sir. I am fine. I am fine. Actually, measuring, I am seeing my oxygen saturation is poor. That is the basic instinct of hiding something. Happy hypoxia is a common manifestation of a COVID patient, but not for all. Those who are having happy hypoxia is the main representation of COVID patient. Having no significant dyspnea whenever they are sitting in a bed or sitting in chair, but the saturation is 82 or 84. That is the Thuja component. That is the Thuja. Another thing is, few patients, those who are recurring Thuja, they are having dreams, especially dream of dead relatives, those who are dead too much ago, or a few patients also not reported me, they have dream of dead bodies, nothing else. Another thing is, they does not disclose his sufferings. Another important point, what we have learned regarding cytokine storm, is exaggerated immune response. Thuja having the basic thing, anything is to be exaggerated. So in life situation, disposition, and a basic pathology of Thuja, we are getting the COVID phenomena in brief. I am not telling about the prescribing indication of Thuja. Now I am telling about few points regarding Sorinum, life situation, strong despair, always in negative stature. Another point is fear of poverty. I may be recovered, but what will be good for my family? Everything is lost. All money has been lost for me. I am not working for last 3 months. For last 1 year, my business has been gone. Same thing is running, always coming to his brain. The main thing is despairedness. Whatever may be the physical symptom, the main thing is despair attitude. All physical particulars I am not telling. Now, last but not the least is the tuberculinum. We all know when indicated remedy worked out but not recovered totally, in consequences, many medicines are indicated one after another with significant relief but not recovered. That is a common thing we are getting in COVID second wave. And that is 60% of cases are being recovered in zigzag way. What Hahnemann asserted in his chronic disease, especially for complicated acute disease, he suggested treatment in zigzag way. But regarding tuberculinum, the life situation, the first thing is, does not obey the doctor's advice. Whatever advice you have given to him, he is not ready to follow all those things. Very much obstinate and desperate. The typical disposition. Another important point, if you inquire regarding tuberculinum patient, the very much cosmopolitan in attitude. Not stick in one service throughout the life. Changeability we will get. Considering all those particular symptoms and life situation, we may prescribe tuberculinum in selected cases. But one thing should be remembered for tuberculinum. Just you will get in Boris Media-Medica relationship chapter, tuberculinum should not be administered without cardiac checkup. We all know in COVID-19 cases, when lung pathology took place, in selected cases, cardiac pathology may take place. Otherwise, he or she may be all right with his heart or her heart. But due to COVID attack, her heart may be affected. But simply considering the symptom and present in totality, we are not supposed to prescribe tuberculinum in COVID complicated cases, unless or until we are having the cardiological assessment from a cardiologist or at least echocardiography from any laboratory. Otherwise, giving tuberculinum with apparent presenting totality, we may not help the patient, rather will cause some harm to the patient. Now I am presenting a beautiful case, concluding case of today's session. How beautifully it was recovered. Let us see. It is the online consent of the patient. Whenever I am treating any patient, they are supposed to give their consent. Myself such and such, bearing other numbers such, being COVID positive, voluntarily opting homeopathic mode of therapy under Dr. such and such. May I request all homeopathic doctors, please take this consent from your patient. You will be in safe side with the law of the land. Every patient or every person having the right to choose his or opt his treatment. Now, as I am presenting his case, her case, I have also taken the consent and she wrote clearly. Happy to share my experiences, and also this video and reports may be presented in any seminar or webinar for betterment of people in general and homeopathy in particular. Thank you, sure, sir. She is one of my students in our institute, postgraduate student. I will not give in detail regarding her symptoms and all those things, as she is telling all things. Just follow very minutely what she is telling.
Hello, myself Dr. Hassanur Jahan, PGT of TND Homeopathic Medical College and Hospital. This is a video to share with all of you regarding current status of my health. That is, I have been tested positive for COVID-19 and I was sampled on 15th April. I got to know about that on 16th April. I have been under medication. I'm making this video to let you people know the symptoms may vary from person to person, but practically what I experienced in this second strain of COVID-19, I'm going to share with you. The very first thing was it was started just like mild flu-like fever, and on 11th April in the evening. After that, at night around 10 p.m., temperature increases in between 102 to 103 degree Fahrenheit. That time I took belladonna 30, 1 dose, that is 4 globulin, half cup of water, and took it in 3 fractional doses at 15 minutes interval. After taking the second dose, my fever subsided, but I started experiencing severe joint pain and body ache, which made me so restless, and followed by vomiting for 2 times. Next day, on 12th April, I consulted with Dr. Bishwajit Basu sir, and he prescribed me Bryonia 203 doses at 3 hours interval on the basis of the symptoms availability like much sweat, thirsty, and desire to lie down. After 3 doses of Bryonia, joint pain completely decreased, and on 13th April around 4 to 5 p.m., anosmia appeared and taste sensation gone. Again, in the evening on that same day, temperature started increasing up to 102 degree Fahrenheit. On 14th April, loose stool appeared, and the peculiar symptom that I have experienced, that loose stool was alternating with anosmia. There was also the evening rise of temperature and severe eye pain. That time I was chilly, there was restlessness and mild stomachache, and sir prescribed me 2 doses of Pulsatilla 30 at 3 hours interval. On 15th April, there was loose stool, nausea, vomiting. On 16th April, I had loose stool, more nausea, but less vomiting, and much weakness. Also, temperature was between 102 to 103 degree Fahrenheit, and I took China 200, 2 globule of China 200, making it 2 fractional doses at half an hour interval as per sir's advice. Temperature subsided completely after taking the second fractional dose. After that, it never returns. On 17th April, I get back my smell and taste sensation. On 18th April, there was mild nausea, chilliness, vomiting, and that vomiting relieves all the symptoms, and there was throat pain on deep inspiration, and I was prescribed Nux Vomica 32 doses. After taking the second dose of nausea decreased completely, and on 19th April, through the whole night, I felt attack of anxiety. I checked my oxygen saturation throughout the whole night, and around 5:45 a.m., the anxiety was at its height, that I started feel breathing difficulties, and in spite of my normal oxygen saturation level, my pulse goes down below 62 per minute, and my hand and legs were started tingling, and they become cold. That time, sir prescribed me arsenic 31 dose, and it acts miraculously, and within 5 minutes, everything became normal, and I had 5 to 6 hours sound sleep. On that same day in the evening, I had vomiting for 1 time, and slight nausea was there. On 20th April in the evening, I experienced mild cough, which decreased after gargling with hot water, and throat pain also decreases. After that, there was no new complaints. I became absolutely fine. Only mild anxiety I felt one night, but very less than before. And on 23rd April, sir prescribed me sulfur 31 dose. There is 1 globule in half cup of water, and after that, no new complaints are appearing as such. And thanks to sir, that's all was the symptom I have experienced. Hello, myself, Dr. Hasanul Jahan.
It is the report actually in the left side. Positive report, and is the negative report. Report is made on the date which actually she told earlier. And this is the way how we treated the cases actually, and how symptom develops in second wave, and how it is differ from the first wave. Different medicine is being required, but not haphazardly. In every spell of developments of symptoms, previous symptom abated, but new symptom, new array of symptom comes. Considering all those symptoms, we have to prescribe medicine. And likewise, whenever we are giving medicine one after another, just simply considering the presenting acute totality, we can mitigate the problem and also minimize the hospitalization. Now I do like to conclude things can only be made easy by an immense amount of collective and impartial hard work. And if we do the drudgery in the beginning of an epidemic, through preventive can prevent a large number of affections. For affected COVID patient, we will find the remedies. The cure will be rapid and gentle, and that avoid case of sickness, make malignant cases simple in terms of major hospitalization, that will be minimized. Thank all of you for your patient sharing. Once again, I pay my gratitude and thanks to the organizer for giving me the opportunity to share my experience on COVID-19 second wave. Namaskar.
Thank you, sir. Thank you so much for this wonderful, enlightening session. And now we have, there are questions in the question answer session, and also there are 9 participants who have raised their hands. First, let us look into the questions which have been asked. First question from Dr. Debashish Mukhopadhyay. Those who are taking constitutional medicines, is it necessary to give any other medicines for COVID-19? If yes, why a constitutional medicine can't cover COVID-19 symptoms? I think you have already answered to this question.
Yes, yes. Need not to give
Yeah.
the times. Already I have answered.
So I'll go to the next question. It is more of a statement. It's not a kind of question. So I think we all know about wearing masks, social distancing, and everything. So this also
Already we have told. Already we have told. Along
Yeah,
with
you
preventive
covered
medicine,
that
we
one.
should follow the COVID behavior. Yes.
Yeah. And the
But it
next,
is not exclusive. Only COVID behavior may not be sufficient. Along with, we have to take preventive medicine. What we are presenting or giving.
Right.
Okay.
and another one, Dr. Dev Prasad Das, he asked, can we accept BAH prophylaxis protocol for prevention of COVID-19, although took arsenicum album 30 as prophylaxis as directed by Ayush?
No. I am telling, if you already took arsenic in a defined dose by Ayush Government of India, you need not to take a Bryonia protocol. It will jeopardize the thing.
Right.
Considering the present situation and second wave, the manifestation of second wave, we have decided if you continue already started arsenic, you may take it. Don't mix it.
Okay. And another question by Dr. Ashish Chakravarti. Can we think Bryonia as genus epidemicus? Is there any nosode, role of nosode? You have said about many nosodes. But still, I think as per BAH protocol, Bryonia is the genus epidemicus.
Already I have told, actually, I have not whimsically selected Bryonia 200 as a preventive medicine for COVID-19 second wave. I have elaborately demonstrated with repertorization chart in COVID-19 second wave, what are the main symptoms we are getting in the onset, whatever Hahnemann said. Considering the homeopathic philosophy and considering the homeopathic principle, we have decided to give Bryonia, as no other medicines came out for this wave. Now, if you would like to follow it, you may follow it.
Right, sir. Thank you, sir. This question is by Dr. P. Chattopadhyay. When showing symptoms of diarrhea with dry cough, anosmia, taste loss, drowning sensation, after vaccination for patients with a history of being COVID positive, what to prescribe?
Actually, getting all those symptoms, we are not supposed to prescribe in any way. We have to collect many symptoms. In selected cases, those who are getting trouble after vaccination, those who are getting few symptoms after vaccination, or despite of taking vaccine second dose, after giving the proper time, those who are suffered from COVID-19, symptoms whichever develops in your economy, that will be considered as per homeopathic principle and accordingly will prescribe.
Right. Thank you, sir. Next question also is from the same participant. Please send the format of consent. I think this is available. You just Google it, Dr. Chattopadhyay, that there are many informed consent form is available, especially the one by BMJ, British Medical Journal, is well accepted. That is available freely in the Google by searching.
Actually, perhaps he is asking about the bar protocol consent form. I will give you to Mr. Bhomik and he may collect it from your concern.
Okay, okay. And another question by Dr. Dev Prasad Das. Sir, have you controlled high levels of cytokines, CRP, D-dimer, IL-6, etc.?
I am happy to share with you for last 1 year and 2 months, whatever COVID patient I have mitigated with homeopathic treatment, nobody get or nobody troubles go to that magnitude. The cytokine storm is so high, the interleukin will be so high. They have mitigated within a very early phase. That is why I am not sure, but if we get the opportunity at our institution, patient is being admitted and all facilities available to do all those things, then it will be very safe and possible.
Right. Thank you, sir. Again, question from Dr. Saibal Nandi about the same, about wearing mask, and also he has given his suggestion. Maybe others can have a look at that. And next question is by Dr. That has been removed now. I think it is removed by the participant. Yes, it is there. Any prophylaxis for all 3 types of fungus?
No, actually, Central Council of Homeopathy, they have published an advisory regarding mucormycosis, but I have no personal experience regarding that. You may follow that Ayush advisory. I have no personal experience on that regard. Actually, what is happening, I do like to point out 2 important things. What is mucormycosis? It is a common fungus we are having in our house also. It is not disease actually. It is a disease state. Those who are having uncontrolled diabetes due to COVID-19 complication, along with immunocompromise due to iatrogenic trouble, taking much of steroids. Perhaps it is absolutely a state of health developed from iatrogenic cause. Hahnemann clearly noted in his organon of medicine, we are hardly able to combat or control iatrogenic trouble. It is not natural disease. We are supposed to give preventive treatment for natural disease only, not for iatrogenic disease. We have to minimize hospitalization. We have to minimize hospitalization through our homeopathic therapy. People are not supposed to be go in that position. That will be our motto.
Thank you, sir. Thank you for your the very elaborative answer for all these queries, and these are really useful. I hope the session was much
Another question from Sheikh Abdul Azim. He wrote,
in which cardiac problem we cannot give tuberculinum?
I am requesting you people, Dr. Sheikh Abdul Azim, please go through Borik's Mathematica relationship chapter. What Borik said actually, as anesthetics before the surgeon, likewise cardiology is before the clinician, before prescription of tuberculosis. Not particular disease. Please go through. It is available.
Right, great. There is one, Dr. Sunit Kumar Rath has raised his hand, and I would like to request him to, Dr. Sunit, please put your query.
Dr. Sunit, you can speak. So please unmute yourself and speak.
You are unmuted now. You can speak. Right. Okay. I think let us move to the next person. Somebody from Galaxy J7 Prime had requested, has raised his hand. So you can ask. You can unmute and ask. Yes, please. I think, can we move on to the next participant who has raised his hand? Dr. Sheikh Abdul Azim. You can unmute yourself and you can ask. Dr. Sheikh Abdul Azim.
Sir, there are some Hello.
Yeah, you are audible. Please go ahead.
There are some situations where we can't control fever. Just for example, I had some patients who had fever of 103 or 102.5, and that was continuously. Can I give any medicine for this to control fever? Any allopathic medicine?
Let me know your identity, please.
I am Dr. Abdul Azim. Actually, there is some practical problem. We are treating COVID patients.
Okay. We are telling about practical problem. We are sitting for to settle up the practical problem. Actually, what is happening whenever any patient is getting fever for a continuous fever with COVID-19, don't be worried. Whenever you are getting fever, just I have presented a case. First, I prescribed Rastox, then Bryonia, then arsenic, and slowly the fever abated.
Actually, patient does not wait. He wants some.
No. Let me complete. What is the thing? Whenever you are giving homeopathic medicine according to the presenting totality of that particular patient, not only you should control or follow the fever. Fever is a pathognomic symptom of COVID. One of the pathognomic symptoms. It is very common to all. Even in modern medicine, people are taking lots of medicine, antibiotics and steroids, and fever is continuous for 1.5 months. You may ask and request your patient. During COVID treatment, fever may persist for 4 to 5 to 10 days even. We, at the same time, we will follow all the parameters. Don't prescribe any antipyretic drug, any combination of homeopathic medicine or any allopathic drugs during homeopathic treatment of COVID patient. What will happen actually, if you administer any other medicine just to combat the fever, the thing will be jeopardized. You will not get the clear picture for the next medicine. You will not supposed to prescribe. The case will be lost.
Right, sir. There is another participant, Dr. Patnaik. Dr. Patnaik, you can speak now.
Sir, in this state of pandemic, is it advisable for go for vaccination, or shall we remain with homeopathic prophylaxis?
Okay, actually, we live in a country. We should abide by the land of the law of the land. Vaccination, if you go through the vaccination protocol published by Government of India, if you go through the fact sheet of vaccination, you will get clearly vaccination is not mandatory now for Indian people. It is optional. But as per modern science and medical science and technology, whatever they have advanced, vaccination in every case, vaccination having some impact on immunological sphere. What immunological development or improvement is taking place out of this vaccination, it will be decided after 1 or 2 years. So I am not a correct person to say something, do not take vaccine. You may take vaccine. Even if you are taking vaccination, despite of you may take Bryonia, you may take arsenic as per Ayush protocol. There is no harm. But don't take it simultaneously. At least you should give some gap, at least 15 days or 30 days gap. But I am not giving you the commitment. If you take homeopathic prophylaxis, COVID will not take place. If you take vaccination, COVID will not take place. There is no guarantee for that. Prophylaxis, whatever we observed with Bryonia and second wave, out of 100, 2% got affected. It is a very good result, but it is a very small size. If it be 10,000 people, we may get more people may suffer, but it is a very good thing we got. Out of 100, whenever we are considered, 2 people are suffering. Out of 500, 4 people are suffering. That is very good thing. But either vaccine or homeopathic prophylaxis, we will not give you the guarantee after taking it, you will not have suffered from COVID. Thank you.
Thank you, sir. Next participant is Dr. Prabir Mukherjee. Dr. Prabir Mukherjee, you can ask your question now.
Dr. Basu, have you tried any time by influenza, or influenza may come as a prophylactic medicine?
Actually, what I have observed, that I have deduced. There is no chance of trial and error in practice whenever a pandemic is going on. Why are you try? If you have tried, anybody have tried on your patients or participants, what medicine comes with you, you just formulate a data and advise accordingly. What I have observed, anybody may have opined with me. That is why in my bar protocol, clearly it has been noted, there is no contradiction, point of contradiction will be encouraged. If you like to follow it, you may follow it. If you do not like to follow it, you may follow any other protocol, a government protocol, any other, whatever you are getting. Even if you personally observe for your area, particular medicine acting very good, and as per homeopathic principle, it deduced all the things and genus epidemicus is being formulated or data formulated, then you may prescribe it accordingly.
Thank you, sir. Now, Dr. Himanshu Shekhar Mishra, please ask your question. Please unmute yourself.
Yes, myself, Dr. Himanshu Mishra speaking. Sir, the medicines you have told is very good medicines. We are using all these, but in case of oxygen level goes low, we are using Aspioderma Q and Pratagas Oxy Q. Whether it will be harm the term of treatment?
Actually, what I like to say throughout all the session, please do not prescribe any medicine without any indication. Unless or until you are getting the totality, don't prescribe any medicine, whether it is a mother tincture or potency or anything. I have demonstrated a case beautifully. After taking medicine, patient temperature was subsided, but saturation was not going up. But considering the presenting totality, we have prescribed medicine in potency, and beautifully it has been recovered. In complicated cases, patients, those who are coming from modern school of medicine, after 21 days or 25 days, they have advised to stay at home. Sometimes that patient may relapse all the symptoms, so its saturation level is low. And I got the opportunity to treat such type of patient in different cases. In selected cases, I could remember the patient, one of the principal of one of reputed college in our in Kolkata, they requested me, and it was in first wave actually, and I refused not to take the case, and it was a hospital refused case, but they requested me like anything, and considering the acute totality, I prescribed Persillella 30 at about 6:30 p.m. evening, and I asked them and advised them, and on prescription it was written SOS hospitalization. Whenever it goes down below 92, hospitalization is a must. At 9:30 p.m. they made me a call, and they said for last 2 hours she need not having any oxygen support. She goes for bathroom and open up the cannula. Now the saturation is 96, 97 for last 2 hours. And she took the night meal and she rested like anything and light with very good sleep without any oxygen support. They arranged oxygen cylinder in their home. In another case, I got the opportunity for a relapse case of COVID-19 with low oxygen saturation and continued fever for 1.5 months. Modern medicine physician told them, fever will be continued for last 3 months, don't bother for fever. Considering the totality, I prescribed Maxol 30. And getting Maxol 30, not oxygen saturation rises up to the normal, the temperature was abated. So I am requesting all of you, please go for acute presenting totality. It will give the medicine. Don't go for any specific.
খাওয়া দাওয়া করো না, জল বেশি সুস্থ।
Anything else? Anyone?
Dr. Sumit Mohan Mandal, you are unmuted. Please ask your question.
Dr.
Dr. Shamit Mohan Mandal, are you there?
You are not audible, Dr. Samit. I think let us move to the next participant.
Vishwanath Devnath. Vishwanath Devnath, please,
Hello.
Devnath, please ask your question.
Sir, I am Dr. Vishwanath Devnath from Kojvihar.
It's my pleasure.
Sir, what will be the medicine in post-COVID cases? The patient is suffering from dry cough.
Okay, actually, it needs another session for 1 hour for post-COVID session. I am treating lots of cases of post-COVID session. Only with cough, I am not supposed to prescribe any medicine. In post-COVID syndrome, there are lots of symptoms, sleeplessness, cough, many things may take place. We have to, just I am suggesting you, along with cough, the cough which actually you are telling, it is the common symptom of COVID. So, apart from cough, you take all those symptoms, patient lifestyle, patient past history, patient family history, physical mental genetics and typical modalities. If fever is coming, the particular time of paroxysm, the apyrexia, during apyrexia, what is the feelings? Just I am telling one point. Patient is having cough with bitter taste in mouth throughout the day. We know different type of medicine. Patient is suffering from cough, bitter taste in mouth throughout the day, but not during eating food. Throughout the day, getting bitter taste in mouth, but not during whenever he is taking meal. The medicine is another medicine, that is sulfur. Likewise, you have to distinguish, discriminate. Out of discriminating observation, you will reduce your medicine and you will select accordingly. If we get any chance, we'll discuss over post-COVID syndrome. Maybe another 1 hour session, we'll discuss over it. Okay, thank you.
Dr. Shaibal Nandi, you are allowed to speak. So please unmute yourself.
Dr. Basu, good afternoon. Myself is Shaibal Nandi. First of all, I'd like to correct yourself. I am not a doctor. I am a simple common man from Chennai. I just like to ask a very simple question. Those who are not affected by COVID, what you suggest for their everyday lifestyle?
Very simple. You just follow the COVID behavior, what has been suggested by World Health Organization, by ICMR, by Government of India, and by your state. Very simple thing, wearing mask, maintain distance, and do sanitize before taking anything. One thing. Another thing, regularly do open air exercise. Regularly do open air exercise. In your room, you stay at your room, open your window, and go for exercise for at least 30 minutes to 40 minutes. Take plenty of water. Take nutritious food. Don't take junk food. Don't take food from outsiders. Apart from that, consider your mental health. Don't feel bored. Whatever you like to do in your good self, it may be reading, it may be listening music, it may be gossiping with friends with phones, but don't go for chatting and WhatsApping throughout the night watching. Don't go for it. Correct your lifestyle. Along with, I am suggesting take homeopathic prophylaxis. It is very harmless. It will protect.
Thank you, sir. Next, Mr. Samir Paul. Dr. Samir Paul. Dr. Samir Paul, you can unmute yourself.
Yes. Hello.
Hello.
Yeah, you are audible now.
Yeah, hello.
Yes.
I want to know about medicine, about vaccination. After vaccination, first dose and second dose, the medicine used.
I did not actually getting what you are asking.
Can you repeat, Dr. Samir Paul?
Actually, what you do like to know? You got vaccinated, then?
Yes, then?
Is there any element? Is there any
no,
element after vaccination?
No ailments.
As there is no element, don't
I
mean-
prescribe as usual, the symptom similarity.
No. As you are not having any symptoms after vaccination or any minor ailments, you are not supposed to take any medicine.
No, after medicine, when arise any symptoms like COVID.
After getting vaccination, if you are suffering from COVID, you have to opt, first of all, you have to opt the mode of therapy, whether it is allopathy, homeopathy, or Ayurvedic. According, doctor will decide what medicine will require for you, depending upon your symptom and all those things.
Okay. Thank you.
Thank you.
One last question, sir, from Dr. Sanchita Chakrabarti. This would be the last question.
Yes.
Dr. Sanchita, you are now allowed to ask. You can ask. I think she is not there. And there are a couple of more questions, sir. If you have time, if your time permits, can we, there are two more attendees who have raised their hands. So can we continue?
Yes, can be continued, but may I request a participant, don't repeat your questions.
Yeah.
Whatever has been answered already in my discussion, in any question answer format.
Very true. Yeah.
Dr. Suman Adar is requested to take the last question. Let us take it. This should be the last question in this session.
Yeah. So
Amrajit Kushal, you are allowed to talk. Please unmute yourself. Ramanjan Kushal.
Good afternoon, sir. What will be the medicine for third wave of COVID-19? Prophylactic medicine.
A very beautiful question. Actually, what I have discussed throughout 1.5 hours, especially in my introductory part, whenever the disease manifestation is not in our hand, we are not supposed to give any medicine or supposed to propose any medicine. We are not like astrological people or all those things. Whenever people will suffer, at least 20 cases is required. Dr. J.T. Kent told categorically in his philosophy, for selection of any preventive medicine in homeopathic field, at least 20 cases to be required. As third wave is not coming, let it be not come. It will be our prayer to Almighty. Third wave will not come. If it come, then as per the homeopathic principle, we will observe the patient and we will reduce accordingly, we will select the medicine. It may be arsenic, it may be bryonia, it may be pulsiplar, nagdomica, any other else.
right, sir. Thank you, sir. Thank you so much for giving nice explanations. And now I request Mr. Abhijit Baumik, who is our zonal sales manager looking after the entire eastern part of India and who has been with the Schwabe Group for I think around 2 decades, Mr. Baumik. Am I right?
Yes, you're right.
2 decades. And with these 2 decades of experience, many things he keeps, many homeopathic information he keeps in the fingertips. And sometimes I wonder that where did he attend BHMS and where did he study BHMS in that way?
That's your greatness. That's your greatness.
Now I would request you, Mr. Baumik, to please give the vote of thanks.
Right. Thank you so much, Dr. Valavan. At the very end of this program, I would like to say one thing, that in the recent past, I have not seen a better interactive session like this. So I have to really congratulate all the participants, Dr. Valavan Sahab and our, of course, most eminent speaker, Dr. Biswajit Basu. and notwithstanding Dr. Shuman Haldar for his fantastic management of this, this platform, which is the Zoom platform. So while we close this session today, I thank once again Dr. Bishwajit Basu sir for taking us one step further in building and even reconfirming the veracity of the homeopathy science. This is one thing I can tell. I also take the opportunity to thank all the participants, the learned participants and the learning participants, for taking out their time and also joining us in this very enlightening webinar. I also thank the Schwabe's marketing team at head office and the sales team of the East India, who have worked very hard to muster this kind of a good audience. And I thank once again Dr. Valavan for taking out his valuable time to moderate this program very, very beautifully. And last but not the least, once again, I would take the opportunity to thank Dr. Shuman Haldar, who has made Zoom platform so stable. And I'm sure this has helped us in making this interaction so fruitful. And as Dr. Bishwajit Basu had said, that let us pray that the third wave does not come, and pray that all stay safe, healthy, and also let us pray that homeopathy comes out more in a very robust manner and prove its veracity and be the benefit for all the people around India and the globe. Thank you very much for joining. Thank you so much once again. Thank you.
Namaskar.